Patients with chronic liver disease require 1.2 to 1.5 grams of protein per kilogram of body weight every day. The old practice of restricting protein to manage hepatic encephalopathy is obsolete and actively worsens sarcopenia. But physicians in India face a hidden crisis. The medical-grade protein powders routinely prescribed to hit these critical targets are severely deficient and contaminated. Relying on pharmaceutical brand names for nutritional intervention is systematically underdosing vulnerable patients, accelerating muscle loss and increasing mortality. A cirrhotic liver cannot store glycogen. A 12-hour overnight fast forces the body into starvation metabolism, breaking down muscle for energy. Clinicians must prescribe a late evening protein dose to maintain an anabolic state until morning. The required sources for this intervention are whey isolates, plant-based proteins, or specific branched-chain amino acids, which bypass the liver and metabolize directly in the skeletal muscle. Precise dosing timing and clean amino acid profiles are strictly required to prevent the cascade of complications leading to liver failure. To evaluate what patients are actually consuming, an independent laboratory study called the Citizens Protein Project 2 analyzed 34 standard nutraceutical and medical pharmaceutical whey supplements sold across India. Results show a massive discrepancy. Nutraceuticals delivered 75.6 grams of protein per 100 grams, while pharmaceutical brands averaged only 29.1 grams. Testing revealed 89% of medical products used cheap taurine for nitrogen spiking, a deceptive practice to fake higher protein results. The analysis also exposed dangerous hidden loads. 44% of the pharmaceutical brands contained high levels of unlabeled sucrose or fructose, alongside frequent heavy metal outliers like cadmium and arsenic. Standard hospital prescriptions are inadvertently feeding liver patients toxic metals and simple sugars, while simultaneously starving them of the protein they need to survive. In contrast, standard sports nutrition and nutraceutical whey isolates consistently met their label claims, provided therapeutic levels of essential amino acids like leucine, and contained virtually zero added sugars. This chart compares the actual economic impact. When you calculate the cost based on the tested actual protein delivered rather than the fraudulent label claim, the cost per gram for pharmaceutical products skyrockets. Independent third-party tested nutraceuticals objectively provide better clinical efficacy, higher safety margins, and far superior economic value. Physicians treating chronic liver disease must immediately stop defaulting to pharmaceutical-branded nutritional powders without independent third-party verification. The new baseline prescription requires a verified low-sodium whey or plant isolate. It must be administered in the late evening, and the ingredient list must be completely free of maltodextrin and added sugars. Implementing this verified, evidence-based nutritional protocol is a direct intervention required to reverse sarcopenia and improve survival rates for liver disease patients across India.